We interviewed a top dentist in Egypt who once worked in New York with some incredible celebrities, including
Michael Jackson.
At Medical Tourism Corporation, we connect patients with highly skilled dentists around the world who deliver stunning smile makeovers with top quality and big savings. Today, Dr. Mohamed and Dr. Nancy from Egypt will share their experience, the treatments they offer, and why Egypt could be the perfect destination for your dental work.
If you can please introduce yourself, like your full name, your specialization, years of experience, educational qualifications, and such.
Well, my name is Mohamed Salah, like the soccer player. Mohamed Salah, the original. I graduated from Cairo University. I'm a second generation dentist. My mother was a dentist also, God bless her soul. She was a pediatric dentist, and she was one of the founders of the pediatric dentistry institution here in Egypt. He's the founder. And I did my undergraduate in Cairo University, did my master's in Cairo University, and then I did my PhD and residency in New York University, NYU, where I did my PhD research and residency. And then after I finished, I worked in one of the high-profile group practices in New York, in Bletchley Park West. And in that center, I learned how to deal with work in a high-profile group practice. It used to accommodate celebrities. Some of the celebrities that I worked on was actually Michael Jackson and Kate Dawson, and many others that used to come to attend this clinic. And I learned a lot about how to manage management from the management side, how to deal with that. And then after a couple of years, I came back to Egypt. Already, my mother has her clinic, and we decided to venture into doing a group practice here in Egypt, which was kind of one of the first concepts in that sense to do this. And this concept actually started working very well from day one. We started getting very busy from day one. And so on, we opened the second branch and the third branch and the fourth branch. Yeah.
Mine will be so short. I mean, nothing compared to Dr. Mohamed, I swear. Like, he's a legend. I mean, okay, I'll try to do it. It's gonna take like 10 seconds or something like that. Okay, so my name is Dr. Nancy Tayea. I was graduated from Hassan University. I'm a general practitioner and whitening specialist.
Dr. Nancy had one thing that actually all of us dream of having. As you can see, you can transcend that through the camera. Her positive energy, and she's a active person. She's doing actually a magic in the clinic, to be honest. And that this thing, they don't teach you that in university. This is a very unique quality. And she's doing a starting job in the center. She took the center where she is right now from one place. She put her completely different.
Thank you so much.
Why do you think Egypt is becoming a popular destination for dental tourism?
Dental tourism has been an interest for us for a long time. We've always had international students coming in. Egypt has a very good dental service.
Egypt is more attracting dental tourism right now is because they have fixed the two problems that people all over the world are suffering from, which is the very high cost dental treatment all over the world, and also the booking system is not easy. I mean, for private clinics, it's not easy just to go like a walk-in patient or even to have an appointment after like a short-term appointment, like 1 week or something. I heard from all my patients, it takes them a lot of time to have an appointment to get seen by a doctor. So here in Egypt, it's very, very flexible. The booking system is very easy. It's very handy on all kinds of booking system, like online booking, through phones, emails. That's very easy. Also, the quality of the service that we offer is just quite even better in some of like in America, with all due respect, in America and Europe, it's even better. And that's not only my opinion, it's our patients' opinion. We have patients flying from Canada, from the States, from all over the world telling us it's the same service. Also, there's another thing that I think is very important for all kind of patients, international patients, which is how we save their times. Like dental procedure used to take a lot of times to be done. Implants, veneers, crowns, root canal. But now it's very easy for you just to come for 1 week to do a full mouth, to do like fix your teeth.
How much again can patients save typically on dental treatment in Egypt?
What I hear from our patients, like the service and the quality is the same, even better, and the cost is 1/5 of what they have to pay back in their countries.
What type of mode of payments you accept at the clinic, and what type of cash are you accepting, like currencies?
We accept cash or cards, and for the currency, we accept all kind of currency. We accept euro, sterling, US dollar, of course, Canadian dollars, any kind of. We try to make it as convenient and easy for the patient as possible.
So what are the most popular procedures right now that you're offering at the clinic?
People are coming from abroad. Do usually do implant, full mouth reconstruction, veneers, clear aligners.
What are dental implants and when are they required by a patient?
Well, then the implants are done when a tooth is missing or tooth is extracted that want to be replaced. Better than doing a bridge because you don't really remove an actual tooth material. And it's a more conservative way of preserving tooth material than doing a bridge. Implants, we use prime quality implants, and usually the regular procedure requires that we place the implant, and then after 2 to 3 months, we place the final restoration or the crown, so that the bone forms around the implant and it integrates with the bone of the patient. We're using also Straumann implants, which consolidation time is much less, so you can load them either right away or in a short period of time. So it requires what we call immediate loading. But that is recommended for some cases. Some cases are not recommended for that. We do Oral 4, Oral 6, depending on the quality of the bone, and each case requires planning, and we, according to that, we do that. We do guided implants. We do surgical plates, so that the place where the implant is placed is pre-decided before we place the implants. Adds to the success rate of the procedure. We do 3D printed dentures, zirconium, and we also do, in some cases, full mouth reconstruction. Maybe it requires more implants per arch, and again, this requires planning case by case. Not every case is the same. Oral 4 and Oral 6, it depends on, it's a denture-based procedure where the patient extracts all their teeth, and then they place 4 implants and they put a denture. Depending on the bone quality, then the final restoration is decided. It could be something light if the bone quality is not that great, or it could be a prime quality of 3D printed zirconium where it has the gum, it replaces the gum, the shape of the teeth, and it has a prime quality aesthetics. So same thing of Oral 6. If the bone quality, and also patients decide that based on price and quality of the bone. So sometimes if the situation is good and in a prime and ideal situation, he can place 4 implants and put a restoration on top of it. Maybe sometimes better, for a better results in the end, you place 6 implants and you place a restoration on 6 implants so that the bone quality is set. But we give the patient options based on our diagnosis and our recommendation in that sense. And we are not commercial in that sense. We think of what's best for the patient medically and financially also. Okay? If financially this can work and will provide ultimate results in the end.
What are dental crowns and when are they required usually by a patient?
So basically, the crown is a full coverage protection for the teeth that is needed. There are so many cases that people might need crowns on it, and there's so many type of crowns that we provide. The patient might need a crown for a weak tooth. This is exactly the whole point from the coverage, is to protect a weak tooth. There's a lot of reasons why it would be weak, such as root canal treated teeth actually they get a lot of it gets brittle like the glass, so it might get broken with hard food, so it has to be protected. This is the most common reason why people go for crowns after the root canal treatment. There are a lot of other reasons, like broken teeth that had to be saved. Also, patient with severe bruxism that they are causing damage to their teeth, they come in for full coverage crowns as well. We have so many type of crowns. We have zirconium crown, we have Emax crowns, we have this another at least required, at least favorite, which is the porcelain crowns. This is what you give us with the recent technology now. We mostly go for zirconium crown, which is the strongest. The Emax crown, which really looks like the natural, and it's very strong as well. It looks really natural, like natural teeth. The veneers are the most conservative shape of the crowns, which is only removing just a few layers from the enamel of the tooth, just like 0.2 millimeters from the tooth, just to stick the veneers. People like it more because they don't want to go for they call it less conservative way, which is the crowns, so they go for veneers now. It's very common, very popular all over the world, not only in Egypt. They go for it just to fix a lot of problems, like broken teeth, like slightly broken teeth, slightly malalignments in their teeth, spacing, cramping, just a little bit. We can fix it by having these veneers. It's fantastic. It's magic now. Treatment so short, and they only come in for one visit, and the other one they receive their veneers. So yeah, that's about the veneers. Also, we have Emax veneers, which is naturally looking veneers, like the shape, the colors, even the slight anatomy of the teeth, of the veneer. You can see, you can't tell the difference between the veneer and the tooth. I'm telling you this.
What's really the process of digital smile design?
Digital smile design is that everyone has a setup of 6 anterior teeth that match their face. There is science behind what used to be done before, that the doctor used to prepare the teeth, send it to the lab, and the lab technician just manufactures the crowns with no regard of the facial shape, all this, so that you find veneers on some people looks very nice, and some others there's a mismatch. There's something not matching, and that's where smile design comes into play. Where you do you do a template for the 6 anterior teeth with matches. The posterior teeth is not that important in the smile. They're important, but the most important is the 6 anterior teeth, and that's where digital smile design comes into play. So there's a science behind it where you match that with the shape of the teeth, how much teeth you show in the smile, and you do that. Once we do that, we do for every veneers case, we do digital smile design, and then we manufacture a template using the digital smile design. And this template the patient wears, and it just shows the patient how the veneers gonna look on their face in reality. And this template actually has 2 jobs. One of them showing the patient how it's gonna look like and what the transformation gonna be in the shape and all this. But the more important is to show us how it's gonna look on that patient's face. So what we do actually, that we start adjusting the template, the mock-up, till we reach the ideal mock-up. Once we reach the ideal mock-up, we'll send it to our lab to manufacture the veneers. So we have kind of knowing what's the outcome gonna be before we manufacture the final ones.
What would be the follow-up process after the procedure?
Even with our local patients, actually, after they are done with their procedures, we have to call them every, after 4 or 5 days to check up on them. If they're still in Egypt, if they're a local patient, they come in again and it's free of charge, of course, for the follow-up. Just come in just to check how the dental work is, if they're happy. We ask, actually, I'm as a clinic manager, I just sit down and talk with them and ask them if they were happy with the experience and everything. So we're going to do the same with the international patients. Actually, we're going to be calling them, having the meeting with them, like this kind of meeting, Zoom meeting, whatever the software is. And we're going to do that just to make sure everything is going well with them.
The most or the must visit tourist spots near the clinic?
Well, I would say the pyramid, the Grand Museum. I still have to go visit. My wife went and she said that's amazing. I heard it's beyond amazing. There is loads of attractions in Egypt. I'm talking about those are very very close to our clinics. But you have in Cairo, you have the Islamic places, the mosques, the citadels. So this is one part of Cairo, and you have the pharaonic Egypt, where you have something that a lot of people don't know. That I think there is maybe 10 pyramids in the area.
Yeah.
One of them I went through maybe a couple of months back, and I was very amazed because this is actually a prototype of the Giza pyramids, and it was really fantastic. Something that you have to see. I told my kids that we discovered the pyramids, and there is so much to see.
We have a lot of monuments and museums you have to visit. The old Coptic Egypt, they have a lot of churches there. You have to come and see it, and all this walking distance from our grands.
I think they have the oldest church in the world.
Yes,
Yeah.
the Hanging Church. Have you ever heard of it? I think it's so famous. There's also you can even in Maayat you can take a walk by the Corniche. Do you know what's the Corniche? What is it called in English? There's a Nile and we have to walk beside it. I don't know what is it called in English. Corniche. We got a Corniche. Where that was very important. Okay. There's a lot of green areas in Maayat. There's a lot of parks here in Egypt that's different than the ones in Europe and in America. You have to go and see it. Did you see the palm trees? I don't think that's really famous there in Europe. You can try the foods. You can try everything. Like we have 4 branches. You can find everything around all those 4 branches. Like Zaire and Giza, you can find the pyramids and pharaonic museums. And Zamalek and Maayat, you can find something else. And we would love to help our patients just to show them around, tell them where to go. We'd love to do that.
When do you think is the best time for dental tourists to visit you for dental work?
I think in summer, like in June, July, it would be a little bit hot for tourists. They can't take that kind of heat. I don't think so. But I think starting from September till after the Christmas vacation, moving on to like March. I mean, you only have to skip like June, July, August because it's really hot unless the tourists can take it. Okay. Other than that, the weather is amazing all the time.
That we would love to show you our beautiful Egypt. Come do your teeth under the pyramids. It's really a beautiful country. It will be a lifetime trip for you, where you're gonna have really state-of-the-art dental treatment and see one of the 7 wonders of the world. It's gonna be a lifetime trip for anyone.
Change your teeth, change your smile, change your life, and come eat molokhaya. That's my message. That's my message.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.